for coming. We just started recording, and it's really great to be able to connect with you all today. This is our third GNN webinar of the year. The idea is to update everybody on the NITAG community, on the different works ongoing within the networks, and we're gonna have especially talk about twinnings. We're very happy with the twinning initiative, and we're gonna see about some examples of successful and not so successful twinnings. Um, there will be a panel discussion with NITAG members participating in twinning. The idea is to have a very active session. Please feel free to ask any questions or comment. You can do it through the comment section or raise your hands. So with that, I'll leave you with Luis, who's going to start the webinar for today. Go ahead, Luis. Very nice to talk to you today.
Thank you, Mario. So before I start the presentation on the GNN update, so you have two parts in this webinar. The first part is a general update on the GNN activities, and then the second part will focus on the twinning program. For any questions that you may have, you can use the Q&A function at the bottom or the chat function, and we will monitor these. If you want to speak, you can also raise your hand and we will give you the right to unmute yourself and speak. So without further ado, let me share my presentation. And yes, so let me go through first the situation of the steering committee before presenting the activities. All of the work that we do at the GNN is thanks to this steering committee. So Mario is the GNN chair, but we have representative for each regions. And we recently appointed a new representative for the Afro region, Dr. Namo Gona, who is the NITAG chair in Zimbabwe. And we also welcomed Chandri Necker, who is the NITAG secretariat in South Africa, who is an advisor to the steering committee, along with Matthew Tunis, Onish Kumar Singh, and Andrew Earnshaw. So these are what we call special advisors. They are NITAG secretariat from long-established NITAG. I also want to flag two changes that will happen in the steering committee. In June, we will recruit a new representative for the Repro region. So you will receive a call for application. Usually we ask a letter of expression of interest and then your CV. And then in September, we will recruit the representative of the MRO region. So the steering committee is involved in all the working group. They are involved in shaping up the agenda of the GNN meeting, and they're chairing some sessions at the GNN meeting. And then for any activities that the partners are doing that needs to be reviewed, the GNN steering committee is involved. So really big thanks to them for their commitment and participation. Among the different working groups that we have in the GNN, there are a few that are about to close, but we wanted to feedback you on their progress. The first one was the survey on off-label recommendations that was led by the Public Health Agency of Canada. And within the GNN, we had Simona and Onish that were standing to represent the network. So this survey was regarding the ability of NITAGs to make off-label recommendations. The final draft of the report has been circulated and submitted for publication. So this is something that will be publicly available. But what has been flagged as potential work to be conducted is to develop case studies to investigate how and when NITAGs make off-label vaccine recommendations and what support is needed. We also have flagged the need for case studies in countries that have conducted post-implementation evaluations to understand how these post-evaluations were done and how the additional data was brought back to the NITAG and may have further influenced the policy development. And then finally, we wanted to look at how NITAG recommendations are communicated to healthcare providers and how the NITAG recommendations are being implemented. So this work, the survey on off-label recommendations is closing with the publication, but we need to investigate how to do the future work that has been advised. The second survey that we did was on NITAG Secretariat. It was circulated in January. This was led by NCIRS. And it was really timely because in March we presented to SAGE and the results of the survey were shared with SAGE members and helped us inform the recommendation of the SAGE. So if you look at the right-hand side in the blue box, you see the comments from SAGE regarding the key challenges for NITAGs, including the lack of funding and human resources for the Secretariat. So that comes from the survey results. And the key recommendations was that SAGE called for countries to demonstrate their commitment by increasing domestic funding to support the NITAG secretariats and their operations, and enacting legislation that recognizes the role, importance, and functionality of NITAGs. So you can find the meeting reports and the summary of that session in the link that I provided at the end of the blue box. Following this survey report, we will also do some case studies in selected countries for each region. We have also proposed to add a question on the Secretariat in the GRF, and then we would like to report back to the GNN community on the results of this survey in a future webinar. So regarding the proposed new question in the GRF, we have submitted this proposition to the eGRF revision committee that will meet in September. So the proposed added question will be, does the advisory group have a dedicated secretariat? And for this question, we add a definition that was developed with the steering committee. And the definition goes, at least one staff member who dedicates a minimum of 50% of their time to both administrative and technical duties in direct support to the NITAG. At first, this question will not be included in the key functionality criteria. So does the NITAG have terms of reference? Or is there a legislative or administrative basis? Or are there at least 5 areas of expertise? Do they meet at least once a year? Is the background information and agenda circulated 1 week prior to the meeting? And is there a conflict of interest policy? So these key functionality criteria is our way to monitor the functionality of NITAGs. So what we're saying is, with this question, initially we won't include that in the core functionality criteria because it takes time to make the reporting process smooth. So we want to ensure that all countries are able to report on that indicator before including it into the key functionality criteria. So for now, it is a proposition. We will get back to you on the results of the outcome of the meeting of the eGRF revision committee. And the final working group that we have is on NITAG twinning. In that working group, we have Mario and Onish, and we have different partners. And the aim of this working group is to develop a guidance on twinning. Since there has been a lot of twinning in the PAO region, we have received feedback on the guidance that was developed last year, and we are currently revising it, and it will be made available by the end of this month. We also intend to do a peer review publication on the experience of NITAG twinnings, and we are really encouraging NITAGs to publish and document their twinning program. So with that, I will, any question regarding twinning, we may wait, we may need to wait until the end of the GNN webinar, since there will be a second part. The other big project that we have with the GNN is the online learning journey. So this is a way to train new NITAG members and NITAG members that have never participated in any training, and to do so online by joining different training where you're able to network with different NITAG members from different countries. Sorry. So within this working group, again, we have Mario and Onish. The idea is to develop the learning outcomes, the curriculum structure, to discuss the format and the tools, to find interactive content, and to develop assessment and evaluation methods. And what we have identified as topics for this online learning journey, we have 12 topics that we want to address. First is a very broad introduction to EPI and immunization system, then introduction to the NITAG, then a deep dive into the roles and the operations of the NITAGs, to provide an overview of some vaccinology concepts, including epidemiology, immunology, and intersection with health economics, health system modeling, and social behavioral sciences. We want to develop a module on market intelligence to get you a sense of how the market is being shaped. Introduction to the evidence to recommendation process, a deep dive on evidence gathering, a module on health economics, a deep dive again on evidence appraisal, including grade. We want to also develop a module on modeling, a module on communication, and then finally on prioritization of new vaccine introductions. That is a new mandate that we see for the NITAGs. So how does this learning journey take place? At first, you will receive a call for application by the Secretariat. In copy the WHO regional focal points. You will express your interest, and with the regional focal points and the GNN Secretariat, we will select 12 people for a morning cohort and 12 people for an afternoon cohort. Once you have been selected, you will receive a welcome package that includes the links for the different facilitated discussion. You will receive a handbook, and you will receive access to the platform where the different modules will be hosted. Most of it is self-paced, meaning for each week you will get access to some content, pre-read, a recording, an exercise, and a test. And then you will have a group session at a set date. So it will, I'm giving an example, it will happen every Thursday at 9 a.m. Geneva time, or every Thursday at 12 p.m. 2 p.m. for the afternoon cohort. So this is an example. So for 12 weeks, on Thursday at 9 a.m. or at 2 p.m., you will have a facilitated discussion with an expert of that topic, where you will be able to ask questions, and you will also have interactive content that you will do with your cohort. And then at the end of the learning journey, you will have a quiz, and that quiz will allow you to get the certificate. Of course, you can meet. We know that NITAG members are really busy. Sometimes the agenda is very packed, so you may need to miss 1 or 2 modules. So you're allowed to miss up to 2 modules. After that, it means that you're out of the program. So what is next for us? Currently, the working group is finalizing the module, meaning we are selecting the pre-read, we are recording the lecture, we are developing the exercise or the case study, and we are preparing the test. So each week you have a test, and then at the end of the program, you will have a final quiz. We're liaising with the WHO Academy to see if this can be hosted by the WHO Academy. We're identifying the guest speakers for the facilitated discussion, and we are planning to launch the first call for application in October. As NITAG members, what will be your role? So if you're interested in applying, especially in the first cohort that will be launched in November, please apply. But note that you will be critical for us because you will be piloting the learning journey. So you will provide additional feedback to us to improve the content and the flow. Also, circulate the call for application to your respective NITAG members because they are not necessarily in this mailing list. Also, provide feedback to the structure, the topics, or the suggested cases if you have any. And if you want to have topics or modules to be developed, please reach out to us. So that's the learning journey. Now, there have been some improvement on the NITAG Resource Center. Minor one for now is the addition of the evaluation tab, where you have for now the tool and the tutorial, but soon in July or August, you will have a dashboard presenting you the results of the evaluations that were done using the NMAT. So for now, we have 84 countries that have done an NMAT, and you see them in blue. We have NITAGs that have been assessed with another tool. These are the 21 in green. And then there are still NITAGs that have never done any evaluation, especially in the WIPRO and the Euro region. So we're really encouraging these countries to do an evaluation using the NMAT. For us, it's really critical because we can use that data to make some analysis by income level, by regions, and to see what type of support is needed for the different regions. The dashboards will not display any country information. It will be anonymized, so it's really looking at regional differences and income level differences. The second big project that we have to be integrated into the NITAG Resource Center is the what we call the compendium, the Vaccine Evidence Compendium. And that compendium is built along the evidence to recommendation framework. So it has a set of criteria with sub-indicators, and we have reviewed a very comprehensive list of data sources, including global, regional, and country data. But the compendium is compiling evidence that is only global at this stage. We are developing it for vaccines, so hexavalent vaccines, HPV vaccines, RSV, and PCV. So for each vaccines, you will enter the compendium and you will get access to summarized evidence with the data sources that have been used to summarize this evidence. The key principles for this compendium is neutrality. We want to integrate it into a platform that NITAGs that are already using, so the NITAG Resource Center. We want to standardize the format, so for each vaccine, it will be the same structure. And we have been involving a lot of NITAG members already have been consulted, and we plan to do a second round of consultation once it is launched in July. So just showing you a few of the visuals so that you have an understanding of what it would look like. So you will have a tab on top called Compendium. Once you click on it, you will have access to the evidence for HPV, Hexa, RSV, and PCV. So when you want to click, you click on HPV, let's say, and then you will get access to this format. And for each indicators, you have sub-indicators with a summary of the evidence that looks like this. So we are hoping it will be useful for both the ETR process, but also if you're doing any exercises regarding prioritization or optimization. So this will be launched by mid-July. And what I've shown you first, the summary of the evidence with the data sources mid-July, and then the second phase will be a table where you're able to compare the different vaccines, and that has been pushed to end of July, probably mid-August. Now, the GNN meeting, which was supposed to take place end of April, has been postponed to tentatively October 28th to 30th. We are waiting to submit the request to organize this meeting in person with the nomination of the directors. So there is some restructuring at WHO. We have new divisions and then new departments. And for each division and each department, we have sometimes new people being appointed. So we were waiting for the head of the division and the director of the department to be nominated to submit our request to organize the meeting in October 28th to 30th. The agenda items have not changed significantly, but there were a few adjustments. And in bold, you see the topics where we would like to invite you to present. So if you think that you could contribute to the different sessions that are in bold, please let me know. Because once it is accepted, we will start preparing with the steering committee, identify the speakers, reach out to the different NITAGs to have to build the agenda. So I'm flagging this. If you think you can contribute to the sessions that are in bold, please reach out. One topic that we have not yet included because it doesn't fit in the 3 days, but we will look at how to integrate that, is a panel discussion on life course immunization and how NITAGs have been able to integrate geriatrics and adult perspectives into their work. And then two final projects that have involved the GNN that I would like to flag to you. The first one is on this prioritization of new vaccine introduction and optimization. We call it VPOP, and there are a few partners, including Gavi, Gates, UNICEF, that are looking at how to support countries around prioritization and optimization, especially considering the expansion of portfolio and the constraint environment that NITAGs are facing. And for Gavi-eligible countries, of course, the new strategy, Gavi 6.0, will be launched and will have significant impact on the way that program can include new vaccines. So that's why we're really trying to create momentum around this concept of prioritization and optimization. And we see a huge role for the NITAGs around these two topics. So by prioritization, we mean decided which vaccines programs to invest in and in what order, especially considering the limited capacity and resources. So in this case, the NITAGs would need to make recommendations on the prioritization of vaccines to be introduced and the sequencing of these introductions. By optimization, we mean the assessment of new products or presentations or schedules or switch to more opportune ones. And again, sometimes some optimization issues may require the involvement of the NITAGs. Other times, it will be just with the API managers. So there have been a few pilots around the prioritization using different tools. There are two tools for prioritization. One is tailored for the NITAGs. It's called the New Vaccine Introduction and Prioritization and Sequencing Tool, NVIPST. And then the second tool is Capacity, which is broader than the NITAG. Following these pilots, the tool has been presented more widely to the NITAGs through their regional offices. and we intend to present that to the GNN. There has also been a presentation at SAGE in March 2025, just after the NITAG session, where we presented the need for prioritization to be included in the development of the National Immunization Strategy, NIS, and we again stressed the role of the NITAG. So just to give you an overview of what it looks like, the process for making recommendations on the prioritization and sequencing, it is different to the ETR process in the sense that you're looking at different vaccines and a set of criteria that you would have identified as critical for this process. So in workshop 1, the NITAG is discussing the list of vaccines and the time frame they would like to consider, and then they are selecting their criteria needed for decision making. Then you have the second phase where you collect and compile the evidence both at global, regional, and local levels, and for each vaccines based on the selected criteria. And that leads to the workshop 2, where you will discuss and vote on the priority and the sequencing. And that will lead to the Secretariat drafting the recommendation and presenting them to the Ministry of Health. So it's really critical when the NITAGs are involved in such exercise that all the stakeholders are informed that this work is ongoing and that the EPI managers or the NITAG Secretariat is involved. And the tool that is in the NITAG Resource Center, I have provided on top the link, looks like this. Basically, it's a set of tools, and you really, you have a document for each step of the process. So it's quite handy, but it takes time. And we're really happy to support the orientation around these, the use of this tool. And we're developing an online training that should be hopefully available in September. The second project that I wanted to flag where NITAGs are involved is the development of a guidance to translate modeling to support evidence-informed decision-making for immunization. This is led by IVRAC. And I circulated a call for providing inputs through the monthly update and through the regional offices. So I really want to thank the 22 NITAG members who volunteered to review the document. You only have 2 weeks to review that document, and then it will be published and presented to the GNN in October during the modeling session. So with that, I am done with my update. It was very lengthy, but at least you can see that even during the period where we don't have a GNN meeting, there are a lot of things that are happening. So I'm opening the floor for questions, either in the chat or you can raise your hand. You can use the Q&A. Happy to take any questions. So I see a thank you for the update. Thank you for the impressive work. So yeah, I really want to stress that this work is being done with the Secretariat, so WHO, but also with the steering committee. And at a time when the global health is being challenged, it's quite impressive to see that people are committed and we're continuing the work. I'm invited Druptop to speak. You are allowed.
Can you hear me?
Yes, we can.
Yeah, in one of your slides it says time frame, no? Workshop 1
Yes.
sometime and workshop 2 taking 3 months or so to make the decisions to introduce the new vaccines.
So this is not to introduce a new vaccine. This is for the prioritization exercise.
Okay, so that is done before the starting of introduction of a new vaccine.
So basically what we are suggesting countries to do when countries are developing their national immunization strategy, they need to look at, they need to do an assessment of the program, and they also need to look at the vaccines that are yet to be introduced in the country and how they would like to go about introducing these vaccines. Can the program afford to introduce these vaccines? How many vaccines can the program affords, and what would be your timeline? And so for this development of the NIS, what we're saying is that the NITAG has a role to provide recommendations. But to provide these recommendations on a prioritization, it will be a bit different to the way you are making recommendations for only one antigen. So because you're looking at different vaccines at the same time, what we're recommending is that you have a first workshop where you discuss among the NITAGs all the vaccines that are yet to be introduced. Which one do you want to look at? For which time frame? Are you looking at the next 3 years? Are you looking at the next 5 years based on your NIS? And then you look at the criteria that you will consider to collect the data, the evidence. And then you have these periods where you collect the data and compile. Usually takes 1-2 months, depending on the resources of the secretariat, or if you have a public health agency that can support, or university. And then you have a second workshop where you discuss the evidence that has been collected. And then you make your recommendation. This timeline that I'm showing you is not a timeline to introduce a new vaccine. It's the timeline to make this prioritization exercise.
Okay, but then ultimately it is to introduce a new vaccine, isn't it?
Ultimately, it is to develop the NIS that will then necessitate you to introduce the vaccines if it is accepted.
Okay, so if we follow this timeline,
Yes.
for example, like COVID vaccine, we won't get that much time to discuss and then get data and all. So that may be a problem if there's a new disease and new vaccines come, for example, COVID. But
Yes.
for
So
a vaccine, but for a disease which is already existing, and then new vaccines are coming, then yes, because then we see that disease, how many cases were there in 1 year, in the previous 2-3 years, we can discuss and find out. But a new disease, a new vaccine, I again say COVID, then this timeline will be difficult to follow.
of course, so this is, let's say, what I've shown you is reflective work. So if you have time, if the country is engaged in developing their strategy, they have a bit of time to reflect and take time to collect the evidence. If there is an emergency situation, let's say Mpox, let's say COVID, then you are not looking at including this into this reflective work. You're really looking at the current evidence and making a recommendation, a timely recommendation, as quick as possible. So don't consider this exercise for vaccines that are for emergency situation or pandemic situation. Okay, so it's really reflective if you have time when you're developing your NIS.
Thank you.
Thanks. Is there any other questions? I see a lot of comments, and I really thank you for your support. Yes, I see another hand. So Lisandro, you're allowed to talk. You can unmute yourself.
Thank you can you hear me?
Yeah.
Louise, I just want to say thank you for all the work. I know it's been a difficult few months, and this is just very impressive, and all the support that you get to NITAGs. And we look forward to working with you on this and other NITAGs, and just tremendous. Thank you so much.
Thanks, Lisandro. Difficult few months and difficult few next months are coming. So if there are no other questions, then I will move to the second part of this webinar, which is on twinning. And for that, bear with me. I have another very short presentation, only 4 slides, and then we will move to country presenting, which will be more lively. And yeah. So yes. So what do we mean by twinning? Usually I would have allowed you to speak, but you can probably put in the chat. I can monitor the chat. So if you could put in the chat some keywords that come to your mind when we talk about twinning. So if I tell you twinning, it doesn't have to be for NITAG, but when I talk about twinning, what are we talking about? So I see pairing, I see partnering, I see collaboration between 2 NITAGs, helping, working together, a relationship, 2 countries collaborating, peer-to-peer exchange, equity, improvement. Yeah, excellent. Sharing the experience between 2 NITAGs. So I think with betterment, yes. Sisterhood, I like sisterhood, to improve together, collaboration. So thank you. And indeed, I think you have captured what we mean by twinning. If we look at definition that exists in our area of work, twinning is defined as a cross-cultural, reciprocal process where 2 groups of people work together to achieve joint goals. It is also defined as a professional exchange and mentoring for the effective sharing of information, knowledge, and technology. So among the keywords that you have listed, there is reciprocity, there is the concept of building personal relationship. It is also a dynamic process. There are joint goals, and there is this idea of sharing and of mentoring. So some of the activities that we will be discussing that can be included in the twinning are in-country visits. In the past, when we started doing twinnings, it was one country visiting a long-established NITAG, but that was more mentoring. So now it's really both ways. It goes both ways. It can include revision of documents. It can include support to the secretariat or to working group. There could be a joint development of policy recommendation. It includes regular exchanges between the twinned NITAGs, and it can include presentation from experts. What we see with the twinnings is really the concept of learning by doing. And as you do, you share your best practices, and then that helps improve the way you are operating. What we also suggest is that all activities that you want to do should be included in a work plan that helps you at least put some timelines and identify the resources that you would need, and allocate a budget if necessary, especially for the in-country visits. So the process that we have identified and outlined in our guidance is, first you have the pairing. That pairing can be done by the NITAG themselves. So let's say I am a NITAG in France and I would like to be paired with the NITAG of Australia. So I could reach out potentially to Australia to be paired. But usually WHO regional offices would play the role of a coordinator, and they would oversee the matching, so identifying who will be paired with who. There will be a kickoff when the 2 NITAGs have been paired. You would organize a call, and where you present the different stakeholders, the NITAG members. You would also in this conference discuss the joint goals that you have within this twinning program. you would develop the terms of reference for your twinning and ideally a work plan. And then at the end of the twinning program, you would do an evaluation, not to evaluate the what has been learned, but more to evaluate the benefits of the twinning and how it has helped the NITAG. So you're evaluating the twinning program, not the NITAG members. A twinning can last from only 1 year if it has very short joint goal to 3 years. And it's really up to the two NITAGs that are twinned to identify their timeline. And also you could see 2 NITAGs that have been twinned that wish to continue even later and even broader than just the NITAG. So with that, I will hand over to Jennifer to present how the twinning program has been set up in the PAHO region, which is the first
Hello,
region
everyone.
to launch widely the twinning program. Sorry, Jennifer, go ahead.
Hello, everyone. I'm just going to share my screen. Let's see. Can you see it? Right.
Yes, we can. If you could put it in presenter mode.
Okay. Hi, everyone. So nice to be part of this meeting. Thank you, Louise, for inviting for us to share. So I'm going to give an overview of the twinning activities that have been going on in the Americas between the NITAGs. So first, just a quick overview to inform you that there are 24 NITAGs in the region of the Americas that represent 45 countries and territories. And important to note that the Caribbean NITAG has a sub-regional NITAG that represents and recommends to 22 Caribbean countries and territories. So all countries in the Americas have a NITAG except for one, which is Venezuela. So really, Louise started off with what does twinning mean, collaboration and all of the other suggestions that you put in the chat. And so for the Americas, really collaboration between NITAGs has been going on for quite some time now. And it started off with the NITAG chairs being invited to the regional technical advisory groups, the RITAG meetings. Since the 2000s, there's already been this type of a collaboration all the way up until the last in-person RITAG that took place in 2019. There's also been exchanges, ad hoc exchanges between more mature NITAGs that have been established for a long time and recently established ones. So mostly between the United States and Latin American countries, and that took place for some years in an ad hoc fashion. There's also been some collaboration and exchanges for Central American NITAGs that have been meeting for some years to exchange their lessons learned and how they're recommending their policies. And of course, we have the GNN, which is where we are right now, where this has been going on since the establishment of the GNN, this collaboration and exchange between NITAGs. So things got a little bit more official when the RITAG of the Americas, the tag in 2019, encouraged all member states with an established NITAG it requested to PAHO, the regional office of WHO, to facilitate exchanges and support among NITAGs, both within the region and globally. And then also in a year later, in 2020, a needs assessment of the NITAGs was distributed to find out a little more about what the NITAGs needed themselves. And one of the things that they said was to increase the exchange of experiences and support among NITAGs in the region. And they also expressed the need to receive more regionally adapted guidelines from neighboring countries. So based on that and also there was a launch of the regional NITAG network in 2022. And so the vision of this is very similar to the one for the GNN, which is an environment which each country of the Americas easily exchanges information and collaborates and learns from one another. And the mission is basically to increase the capacity of the NITAGs through regional collaboration and cooperation. So based on that, and going into transitioning into the twinning programs, we conducted a survey, and we had 23 NITAGs respond to the survey. 22 of them responded to the survey. And the first question was, if twinnings were to be created, would your NITAG sign up? And you can see from this slide that, 21 NITAGs would sign up without a hesitation for a twinning program. And one NITAG didn't respond, and the other one was just a little uncertain. So that showed already the enthusiasm of the region to want to have this exchange among NITAGs. An assessment was also done using the maturity assessment tool, which is the most recently developed tool to assess NITAGs. And based on this self-assessment, because it was a self-assessment that was sent out to the 23 NITAGs at the time of the Americas, the results came back that most NITAGs in the region are basic or developing in all the indicators except for the first indicator, which is establishment and composition. If you look at the indicators 2, 3, and 4, which is the independence, resources, and operations, that's where you see the highest proportion of NITAGs at a basic level. So the most challenging indicators are in that part. And also, there's more of a higher level of maturity for the establishment of the NITAGs, the formulating of recommendations, and the stakeholder recognition. So based on the self-assessment, also the needs assessment, the regional NITAG network executive board looked at the different maturity levels, and here you can see them. You could see that 35% of the NITAGs in the region are basic in maturity level. The other 35% are developing. There's the 26% that are intermediate and 4% that are advanced. So really a mix of a little bit of everything, hodgepodge, which actually made it really easy, I guess, to have to twin the NITAGs. So based on the needs assessment, on the survey, as well as the self-assessment of the NITAG, these were the group suggestions that were done, were suggested. And you can see there's intermediates with developing, the developing with developing, so a little bit of everything to start off. And also important to note that the board of directors, and you see their pictures right here, were key in the contribution to the development of the twinning survey, and also the twinning strategies, as to who was going to be twinned with who, based on which indicators, and how we were going to start this process was based a lot on the RNA executive board. So if you look at this slide, you see that since January of 2024, when the NITAGs first really jump-started their twinnings all the way up until now, you can get an idea of how many of the NITAGs have been active. So first of all, we've got 12 twinning programs, and some of them have met more than others. You also see the types of twinning, right? You see if it's the NITAG Secretariat and the NITAG core members, if it's a working group, if it's the Secretariat and working group. So a hodgepodge, and of course the NITAGs have decided that by themselves. And they also decided if they were going to, how long they were going to have their twinnings for. And some of them are still to be determined. I just wanted to highlight briefly that, and there's a mistake here, but Brazil, but it's actually Brazil and Cape Verde, that in my first slide, we talked about the recommendation that, oops, let me see right here if I can get it. In this slide, the tag recommendation was that there would be to facilitate the exchanges and the support among NITAGs, both within the region, but also globally. So when you talk about that, the NITAGs of the region have also had exposure or the option of twinning with other countries that are outside of the region. And one of those is Brazil and Cape Verde. Here's not Brazil and Brazil. Where they were able to meet one time in Cape Verde, and the discussions are still taking place. So just really excited about these twinnings, and the topics of discussion in the twinning meetings. I showing them right here, but they've discussed many topics, and I will not get into the details because I think we'll get some more details about that in some of the examples. So what are some of the lessons learned so far from the twinning activities in the Americas? Well, first, what we're seeing is that it's an innovative strategy to strengthen evidence-based immunization policy, and that the NITAGs are excited and really happy to have this exchange between each other. There's this Pan-Americanism and unity. I think that when you look at that survey, the first survey, most people really were not quite familiar with what this twinning would take, how it would be structured and how it would take place. But most of the NITAGs, all of the NITAGs were really excited about this. And we think that the Pan-Americanism, this unity between the countries was important in that excitement. Also, we've learned that the relationship between NITAGs and their secretariats is key. If you look at that table of how many of the NITAGs have met and some who have not met as often, a lot of times the secretariat plays a key role in that, whether they're meeting or not. So really important for the secretariat to be involved in this process as much as possible. And also the secretariat support determines long-term commitment and sustainability. Another thing is that the political will and dynamics influence twinning establishments and effectiveness. The NITAGs that had elections or political instability or some kind, that also delayed the process. So that's another lesson learned, that just looking at the dynamic of the country plays a role in whether this gets jump-started or not. And the last is the PAHO plays an important role. We've seen that just being the in-between, so not really being involved in the technical work and the conversations between the two NITAGs, but just the coordinating of the meetings is key. So I think I'm going to stop there. We've had 3 regional NITAG network meetings where the NITAGs have been able to meet in their twinning roles. So this was just an opportunity to meet in a bigger setting, and then there's the individual one. So I'm going to stop right there. Louise, thank you so much. Over to you.
Thanks, Jen. So there will be opportunity for questions and answer after the presentation by May-Ann. Noting that there will be a panel discussion with several countries in the PAHO region who will share their experience with you. So May-Ann, of the other regions that started twinning way back, so way before the PAHO region did, is Australia with Timor-Leste. That was the first established twinning. And Australia has also twinned now with Vietnam, and May-Ann is going to present you.
Được chưa? Các chị chưa thấy được này. Good day, esteemed college. Kindly give me a moment to share my screen. Can you see the screen now?
Yes, we can.
Yes, okay. And I will start my presentation right away. Good day, esteemed college. I am Mai Anh Nguyen from the University of Sydney Vietnam Institute, and I'm speaking today on behalf of our technical collaboration team with NSER and SVI. I'd like to thank WHO and the Global NITAG Network for the opportunity to contribute to this important dialogue. and to ensure for facilitating this exchange. And it's an honor to share Vietnam's recent experience in strengthening its NITAG through timely action, local leadership, and a meaningful collaboration with Australia ATAGI. To begin, let me take you briefly through a broader context, Vietnam immunization system, and why enhancing the NITAG capacity became both a strategic need and a timely opportunity. Vietnam immunization system is large, complex, and highly decentralized, with over 10,000 community health stations and more than 700 district units, all coordinated by regional and provincial EPI centers. In such a setting, NITAG's role is critical. Its recommendation directly impacts the health of nearly 100 million Vietnamese people. But by early 2023, as the Ministry of Health prepared to introduce HPV and pneumococcal vaccines, it became clear that Vietnam's NITAG was facing serious limitation in capacity and structure. And that was a defining moment, one that called for timely and strategic intervention. And a WHO NITAG maturity assessment showed that Vietnam's NITAG met only 40% of required criteria. Key functions like decision-making, policy integration, and stakeholder engagement were operating at just 25%. And internal reviews confirmed the same story. No operational budget, no full-time secretariat, irregular meetings, and limited access to data. Yet there was great potential. Vietnam had highly capable and independent experts. What was missing was a structure and support and a system that worked for Vietnam's context. And this is where our partnership with NCUP came in. And it began with a scoping visit to Vietnam in August 2023, led by Professor Christine Martinet, Director of NCUP. Together, we identified 4 immediate priorities. First, strengthen NITAG system. Second, build capacity in policy and technical areas. Third, support the introduction of new vaccines. And fourth, engage key national and international stakeholders. Later that year, in November and December, the Vietnam NITAG Secretariat visited Australia, learning firsthand from peers, enhancing evidence process, and strengthening links with the Ministry of Health. And we also held 3 focus workshops covering evidence-based decision-making, regional collaboration with NITAG from Australia, Canada, and Singapore, and identifying local data and research gaps. As part of this, 2 key tools were co-developed: the Standard Operating Procedures, SOPs, adapted for Vietnam system, an evidence to recommendation framework aligned with global standards, but tailored for local use. These tools have helped structure and professionalize how evidence is used in national vaccine policy. This progress was only possible through strong partnership. We work closely with Vietnam Ministry of Health, the National Institute of Hygiene and Epidemiology, and NITAG. And we sincerely thank NCA for your tireless technical partnership, and Gavi for the generous financing support, and the University of Sydney and DFIT as our governing and funding agency. Together, we have strengthened Vietnam's immunization ecosystem. We also linked policy to practice through the continuous immunization professional education program, training health workers to implement decisions on the ground. And today, Vietnam's NITAG has moved from a fragmented advisory group to a recognized national body with a functioning technical secretariat, standardized, transparent decision-making tools, and an active voice in national immunizations policy. The group has already influenced real change, recommending the introduction of HPV and pneumococcal vaccines and updating the immunization schedules. This growing Vietnam-Australia exchange continuing this month from the 14th to 21st. A high-level Vietnam delegation visited Australia for a structured learning exchange under the Middle Income Country Strategy Project supported by Gavi and the FAT. The visit connected the delegation with a broad range of Australia partners. Firstly, we met with key policy and government agencies, including the Department of Health and Aged Care, New South Wales Health, and the NITAGs. The delegation largely observed and learned during NITAGs' two-day plenary meeting in Canberra, gaining insights from technical discussion and stakeholder exchange. Next, they visit academic and research institutions such as NCER and the University of Sydney, where discussion focused on training, use of evidence in decision-making, and implementation research. Finally, the team explored opportunities for innovation and collaboration with organizations like New South Wales Investment and the RNA Institute at the University of New South Wales. Discussion co-development, technology transfer, and regional partnership. And now here's some highlight from the trip, kindly captured and happily posted by our college. Yeah, and this twinning model is now expanding into long-term collaboration with key focus areas including joint research on vaccine performance, safety, and service delivery, and of course, communications. Co-designed training for early career public health professionals, and regional exchange among NITAGs in the Asia Pacific and beyond. In addition, data-driven collaboration between the expanded with Vietnam institutions, such as the National Institute of Hygiene and Epidemiology and the National Children's Hospital. These organizations hold rich datasets from both preventive and clinical systems, offering valuable opportunities to study vaccine impact, improve health system efficiency, and advance equity in access. Together, these efforts aim to strengthen both policy and the evidence that drives it. All of this reflects the power of the four right models, the right timings when the system was ready for change, and the right approach, co-designed with local needs in mind, the right partners offering both technical depth and mutual respect, and the right community service, because ultimately our work must serve people. And this is not just Vietnam's story. The four right models can be adopted by any country seeking to strengthen its health advisory system through local leadership, international cooperation, and a shared commitment to evidence-based policy. And our team here, the progress so far has been significant, but sustaining it requires ongoing effort. Vietnam's NITAGs still faces challenges, especially the government carries out broad public sector reforms and the health system adapt to new needs. Now it is an important time to build on this achievement and show continuity and create advisory groups that are flexible, transparent, and responsive to society growing demands for quality and evidence-based care. On behalf of our team, we thank the Global NITAG Network and WHO for providing this platform, and thank our team for their hard work and support, and thank you all for listening. That is my presentation. Thank you.
Thank you, Mayan. Thank you so much. Now we will move to the panel discussion, and I will invite Jacqueline, Jocelyn, Vanessa, Angela, and Herbert to turn on their camera. So Angela is the NITAG chair of Argentina. Argentina has been twinned with Ecuador. Herbert is the NITAG chair of Guatemala. Guatemala has been twinned with ACIP. Jacqueline is Jacqueline online? If Jacqueline is not on, Jacqueline is online. So Jacqueline and Vanessa are from Haiti, and Haiti has been twinned with Canada, and Jocelyn is in the secretariat of the Canadian NITAG NACI. So I will ask questions, and feel free to raise your hand if you would like to ask some questions to the panelists. So probably first, Angela, could you tell us a bit about the start of the twinning and what was your role?
Well, I am the president of the NITAG of Argentina, and we connect with the president of the NITAG in Ecuador, Dr. Greta, and we talk together about the possibility to make this relationship and to work together. We have our first nighttime meeting, both committees, because we received the visit from Ecuador in 2024. And they participate in our meeting. Yes, this is it was the first situation to begin to make a strong relationship. And we talk in this moment, we have a very challenge meeting, because we are just discussing what we are going to do with dengue vaccines. And we have a very big outbreak of dengue, and we begin to discuss all the recommendations about this. And was really a very long session, very interesting, because Ecuador gave us their vision, and we discussed our recommendation. So the most important things is to make this relationship very strong and over time. And we have another possibility to meet with Ecuador in the Ecuador NITAG meeting, and in two other three occasions, because I participate in NITAG Central American meeting and Andean meeting. This year, another meeting in Ecuador with NITAG meeting of Ecuador. And well, it was a really a very important experience to try to share our problems, to share what we are working along. The possibility to learn each other is very important, to try to get of the different experience the best for our countries, and to make this Latin America, to contribute to this Latin American network. It's very important to go on along of this route.
Thank you, Angela. I see a lot of questions, so I will briefly ask two questions to Herbert, to Jacqueline and Jocelyn, and then I will open for questions from the audience, because I see a lot. So Jacqueline and Vanessa, could you describe what was the process to start your twinning, and what specifically did you include in the twinning program?
Hi, everyone. Nice to meet you all. So in Haiti, actually, our NITAG was very new. It was at this time maybe the youngest one. And the World Training Project with NACI Canada was part of the plan on our side from PAO to help NITAG in America. And that was like from the Red Consortium Perim. And that project was launched in Rio in 2023. And it was like very important for us to be part of that effort, because we definitely feel that we need like the sharing experience from a more advanced NITAG, if I must say. So our new committee was represented in Rio by our NITAG president, but also by the director of the vaccination program in Haiti. And the proposal was made to pair Haiti with NACI, with Canada, and that was accepted. And since that period, we started to work with them since like almost 2 years now. So what is part of our program, like the main activities that we have done together? First of all, it was important to define like the structure, the operation of our work. So on both sides, we identified some focal points, one from Canada and two from Haiti. And the three of them, they meet regularly to discuss and to plan about like the whole training follow-up. So for example, they propose a work plan with objectives and activities that we will need to follow through during the training period. And the other activities that we have worked together, for example, was sharing experience and knowledge. For example, we were drafting our recommendation for HPV, and we invited NACI to one of our working session, presenting what we have done in Haiti about HPV and how we are thinking about our recommendation. And they also invited our members as well, the focal points, to their annual meeting as well. So it is like sharing knowledge and experience on both sides. And also when we complete our first recommendation, we submit them to NACI Canada so we can receive feedbacks, because it was our first recommendation. We also discuss about challenges that we can have, for example, on an operational perspective with them, and we receive advice. For example, at first, we had like many questions about like the structure of the technical secretary and how to build that new structure for us. And we also discuss about like maybe some tension that can happen between our group and the health ministry. So all those discussions really help us shape our actions and follow-up activities. And
Vanessa,
also,
may
yes.
I ask, are all the touch points and meetings where you invite NACI, is this only virtual?
Yes, our regular meetings are virtual, but as I say, we had two focal points from Haiti who actually went to Canada actually to participate in one of their annual meetings. But in general, all the regular meetings, they are virtual.
Thank you. So one question for Joseline. So we are hearing how the twinning benefited Haiti, but has the twinning also benefited Canada?
Well, yes, it has. And I think one of the first thing I wanted to say is that if the twinning has been able to take place at all, it's really due to the dedication of the AT team, who decided to move on with the twinning despite the political challenges they've been facing and also the technical challenges. And from the NACI's end, twinning with AT has helped. Well, when sharing our experience, it really helped us really further think about the processes we have in place and why they've been put in place. NACI has been in place for more than 60 years now, and many of our processes are already well established. And when sharing our experience, because of the difference in context between Haiti and Canada, we kind of needed to reflect at a more higher level about what are the overarching principles that are applied, not necessarily relying specifically on how Canada has decided to address those challenges. So, for example, she mentioned about how tensions the Secretariat can face between the NITAG and the Ministry of Health, how that can be addressed. Another example of experience we've shared, it's about challenges for the implementation of the immunization programs once the recommendation has been released. And that discussion really helped us highlight the fact that implementation is being prepared very early on in the process, even when drafting the NITAGs working plan, as you mentioned, prioritizing what the NITAG needs to address, and that needs really to happen in collaboration with the EPI program coordinators to really know what are their needs, and that the discussion needs to be going on even when the recommendation is being developed, to kind of account for feasibility challenges they might face on the field. And that even when the recommendations have been released, that conversation needs to continue. And if they have any challenges that they face on the ground, there could be adjustment to the guidance, or the NITAG can provide that scientific evidence-based approach to help them address challenges that they face on the ground. So yes, it was really a very good learning experience for us also, and gave us an opportunity to really think about our processes and structure.
Thank you, Joseline. And now I will turn to Herbert, NITAG chair of Guatemala. Guatemala was twinned with ACIP, and I see in the chat one of the questions is the challenges in twinning. So I think in addition to introducing how you were twinned with ACIP, I think you're very well placed to talk about the challenges when you're being twinned with a NITAG that is ongoing, restructuring, political disruptions.
Thank you, Luis. Thank you for the invite. Thank you, and hi to everybody. Yes, I think as a human relationship, it has several challenges. Some challenges. Well, I think that we started very strong, and start our dating in January, and we have held 11 meetings in 2024. So we have several exchanges between our NITAGs. As in a date, we started with some basics, sharing how we are making our process. Each NITAG had time to share that. Afterwards, we have some preparation or some planning of other meetings that we want to have. Some were about the evidence to recommendation framework. We have learned from ACIP that the methods should be taken in place for every meeting and evaluation. So, and we have had some little, maybe barrier with the language, because we mostly of our NITAG members are Spanish speakers, but we have support from PAHO with interpretation, and also I think at some level there is a very fluent communication in that, so we could solve that. Another maybe barrier could be the time, but we find a great time to engage members and ACIP at noon every month. So I think that worked very well for both parts. And also now we have some political change in the US that stop some of our plans for 2025. But we hope that at some point we will find the way to overcome that. And I will take just 30 seconds for a question that raised someone of what are the best or what we learn. We learn from ACIP that they conduct large meetings instead of short meetings. So we would like to have that model because we think that it's better to have large sessions every 2 or 3 months. Maybe that could be better in time of effectiveness. And the other thing that we learn is that having working groups, I think it's very important to mature the discussions and the analysis, and then come to the NITAG to the entire NITAG to bring the information. Thank you.
Thank you, Dr. Herbert. I saw you had a question, and you're allowed to speak if you can unmute yourself and ask your question. Okay. No, as he is not unmuting himself, I will move to the other question that I saw regarding the plan to establish twinning between countries from different WHO regions, such as CRO and MRO. So MRO has also launched, similarly to PAHO, an initiative to twin NITAG within the region. But we also gave in the chat example of like Vietnam and Australia. We also gave example of twinnings that happened across regions. So Jennifer mentioned Brazil with Cabo Verde. There is also Timor-Leste with Australia. So it is possible. What you would need to do is go through your WHO regional office to support, or through the GNN, to support these arrangements. Angela, another question to you. What have you learned through your twinning with Ecuador?
I learned the possibility to share experience each other, which was very important, because when we discuss in this moment we discuss dengue, but also another recommendations like measles, the second dose of measles, and to try to get the second dose early in the second year of life. And we discuss about RSV and the introduction of RSV, because in 2024 Argentina make an introduction, and we have RSV maternal immunization and national calendar. So we share this experience, but especially with dengue, we learn a lot about Ecuador, because they talk about all the challenges they have and what happens, especially with measles, what happened with the different schedules. So it's a very, very important experience. I think that because it will be very important, the future documents, to try to get this type of twinnings more structured, no? Because we need financial support to try to repeat this visit. Not only we receive Ecuador, but also we go to Ecuador, but perhaps not only me, because I stay in Ecuador because I was invited by in the middle of a Congress, a Latin American Congress. So it was the possibility with Jennifer and with Mario Melgar to share some experience, but perhaps the possibility of the core members of each NITAG join together. So it's a challenge for us to go on with this experience. In the last meeting in Panama, we received the possibility to also to have a twinning with El Salvador. And when we are working on this with Jennifer and with Elber, and with Jennifer and with Mario. And of course, it is very important to go on in this direction. But it's a challenge because our countries are in the middle of our twinning. We have a change of government, and also we have new challenge about that. And so perhaps in the first months, we need to try to get this new accommodation, no? To try to get this new change and to try to make all our efforts to go on with our night. And now we are working very hard. It's a very good moment to reinforce, to make a lot of activities about these twinnings.
Thank you, Angela. Nancy, I see your hand up. You're allowed to unmute yourself and ask your question. Nancy Munoz Lopez. Okay, maybe it's a mistake. I see another question that I will ask to Vanessa and Jocelyn. Some participants are asking regarding the funding of the twinning.
Excuse me, Luis, excuse
go
me,
ahead.
I'm Greta. Excuse
Okay.
me. No, I just want to thanks for intervention of the Angela. She and I am agree with all of she said, and only I think we need support to continue it, because only 1 or 2 visits is not enough to get every more with more time to be a strong NITAG.
Thank you, Greta.
That's all what I want to say, and thank you for all. Thank you, Angela.
Thank you,
Thank you.
Greta. It's really nice to hear you, and well, to go on with our activities, because we learn each other a lot, and we have an excellent relationship between the two NITAGs. So
Thank you very much.
go
I
on.
think I learn more from you and for all of you.
Oh, we learn of
Thank
you,
you.
of course.
Thank you. Thank you.
Thank you. So
Bye.
Greta
Yeah.
is the NITAG chair of Ecuador, which is twinned with Argentina. I see also Dr. Ali, if I'm not mistaken, from Somalia. You can unmute yourself and ask your question.
Hello, everyone. Can you hear me?
Yes, we can.
Oh, thank you, Luis, for actually organizing this, and all the other panelists. I just want to know, of course, we are also now struggling to understand more about the twinning and how to process it and how to get benefit from each other. Yet we didn't do it actually, but it was a discussion is about the twinning in the region before. So I just want to know, to ask the panelists, in their experience, where did you get the support? I mean, in terms of financially, as well as visiting from one to another. I know it's not easy. You get support from your ministry or any other sources. I just want to know your experience. How did you manage all of those?
Thanks, Dr. Ali. So I will ask Joseline and Vanessa to mention if there has been any financial support coming from your NITAG, Joseline, or from your country, Vanessa, and if so, was it through Gavi? Also mention the role of the WHO regional office. And Dr. Ali, just to refer to May Ann presentation. May Ann also mentioned that she was using the Gavi funds for the twinning. And in the experience shared by Vinod in the chat, Timor-Leste and Sri Lanka, or Timor-Leste and Australia, they were also using Gavi funds. So Joseline and then Vanessa.
So in terms of funding, we received support from PAHO, which funded the in-person visit of our IT colleagues in Canada, and also provided translation services for our meetings that were mostly held in French. At the Canadian level, we of course had the approval of our director to participate to this twinning. To my knowledge, there hasn't been any financial funding to support this, but more in-kind funding with the resources and time that have been dedicated to maintaining this training over time.
Thank you. Vanessa?
Yes, this is the same on our side. So we receive funding from PAO as well, like funding as Jocelyn mentioned it, for translation and support if we need to travel. And PAO as well, because I think one of the questions was like other kind of support. For example, they help us if there is like some facilitation to do with the health ministry. So they give those kind of support as well. But this is mainly the kind of funding that we receive.
I see Angela has her hand up, and then also
Yes.
I would invite
No.
Jennifer.
Yes, and also clarified with our relation with Ecuador. When Ecuador visit Argentina, we have the support of PAHO So they coordinate with Ecuador PAJO, Ecuador focal point, to try all the organization of the travel and all the organization of housing and so on. And so, well, in general, is PAJO support. Perhaps is our experience, but perhaps Jennifer or Mario could add more about Latin American NITAGs.
Mario or Jennifer?
Yeah, so basically we have had some funding. So PAJO has received funding, a grant from the Wellcome Trust, and it's all about the supporting of these twinnings. So we have encouraged all of the twinning collaborations to speak up if they wanted to have some exchanges in person, interpretation, even coordination. So just to confirm that, yes, we as PAJO are here to support the twinning activities. This grant is all the way up until next year of next year. So thank you.
There is one specific question from Ush regarding the MOU, and that would go to Joseline. So I mentioned that there has been a memorandum of understanding with Haiti and Canada. Would that MOU extend to the national ministries of each country, or was it just between the two NITAGs?
Well, on our end, it also involved the Public Health Agency of Canada, because the NITAG operates under the supervision of FAC. So we had to have the agreements to make this MOU with the Haiti NITAG. But I'm going to pass it over to Vanessa to comment about how it happened and what's the structure on the Haiti side.
Yeah, on Haiti side, as Jocelyn mentioned it, the technical secretary, for example, is part of the immunization program for the health ministry, and they're also like represented in our NITAG. So before we have that whole MOU signature, we needed actually to discuss that with them as well.
Thank you. I see Dr. Mohamed Souma you're allowed to unmute and ask.
Thank you, Louise. Thank you for all speakers for the quality of your intervention. I would like to ask what is the criteria of matching the twinning training? I mean, you match the NITAG who has a high level of maturation and who has a low level of maturation. I don't know what is the criteria of matching each NITAG. I'm from a NITAG of Guinea. Thank you very much.
Thank you, Dr. Souma. So I will answer and then Jennifer can complement. We are drafting, we have developed guidelines on how to do a twinning program, and we have included that question in our guidelines. What we do is what we say for the pairing is that you have to take into account several aspects, including the language, the cultural sensitivity, the maturity of the NITAG, but it's not the only factor. The goals that you want to achieve through your twinning. And if you have already experience in working with that country for different programs. So these are some of the aspects that the coordinator would consider to pair the NITAG. But we are not only pairing NITAG that have one high, long-established NITAG with a high maturity and a developing one. As we said at the beginning when we were mentioning the keywords around training, it's really a joint collaboration where you learn from each other, and it's not top down. So the level of maturity is not enough to be paired. Jennifer, do you want to complement?
Yes, just to complement that, so for the region of the Americas, most of the NITAGs are basic and intermediate. So when we looked at with the executive board of the regional NITAG network, looked at all of the maturity levels, we knew that we couldn't pair, everyone with a different level, meaning a higher level and a lower level. So really, there's a hodgepodge of everything, and what was focused on was really prior relationships, working together, the desire to work together. We also factored in language for some, other prior context, political context, social context, prior relationships context. So we kind of looked at all of it, and it was, and at the end, as they matched in the NITAGs, there was also some emails that went directly to the NITAG members and their secretariats and asking, out of all of these NITAGs or all of these countries, who are you interested in twinning with? So it wasn't just, so it was a discussion between the NITAG, the secretariat, the regional NITAG executive board, conversations. And it's important also to note that as we're going on and learning about how these twinnings are done, we see that there's some NITAGs, for example, that are twinned originally or with their original twin, but have asked to twin with a third NITAG. I think Angela mentioned that there's a twinning between Argentina and Ecuador, but now El Salvador has some questions and would like to twin with Argentina on specific issues. So it's a lot about being innovative, creative, flexible, and I think that's how we've created these twinnings, and that's how they've been working. Thank you.
Thank you, Jennifer. Dr. Vinod?
Thank you, Luis. I hope you can hear me.
Yes.
So I just wanted to share in Sri Lanka and Timor, although both the countries have a very different level of maturity programs, but the key challenge was how can Timor learn from a conflict-affected areas and how can you sustain good immunization in conflict-affected areas. Sri Lanka had a pocket of areas which had conflicts, and Timor being a very young country which had come out from a long conflict duration. So there were common areas of learning between these two countries. And the twinning program was not limited to Timor visiting Sri Lanka, but it was also that Sri Lanka went back to Timor to see how they have implemented and what lessons they had learned and how they have tailored them to their regional local context. So that was, and this was an MOU signed between both the ITAGs, facilitated by the WHO country offices and supported by Gavi. And it was really helpful. And subsequently, Timor did partner with the Australians to take that work forward. And being a very young nation, they have done tremendously well to improve their immunization coverages and introduce new vaccines out here. Thank you.
Thank you, Dr. Vinod. I see we're past the timing, but I see two very good questions in the chat. One, I think, Herbert, you can share your experience, and then Jennifer can complement. But is twinning where you would look at a specific policy question possible, and is it what you did with ACIP, where you were looking at a specific policy question?
Yes. Yes, absolutely. In fact, I think this was one of the major learnings from our NITAG, that to understand that the evidence recommendation framework must be in place, and we are forwarding to there. So we had the opportunity to discuss about some recommendations from ACIP and how they went to that recommendation. They had time to explain in detail, for example, addressing some equity aspects of the framework. Also, recently, 2 weeks ago, there was an opportunity to have a training on the evidence recommendation framework, also with collaboration with PAHO and GNN. So 4 other members went to that training. So I think these are great exchange that we have a process to understand and to growth in our member. So also we have also that the same visit to ACIP meeting in the US in October last year. So we also have some of our members that went to the meeting and have very clear that there are many aspects that could be strengthened, and yeah, I think that's a great way to grow. See other pairs in other countries that have a way or a guidance to do things. So to respond clearly to your questions, yes, it was very helpful to understand policy questions with the twinning.
Sorry, I had to open the door. Jennifer, can you complement?
Yes. So regarding the policy questions, I think that the main reason why a lot of obviously NITAGs are doing this twinning is to focus in on a specific policy question. But before doing that, if you don't really know the other NITAG, the lesson learned is that most of the NITAGs didn't just jump into the policy question because they wanted to get a better idea of the structure, of the basis in which the other NITAG was living, the environment, the context. So even though I think the heart of the twinning is about the specific policy questions that the NITAGs are struggling with or that I have questions about, the first couple of meetings between the NITAGs is usually basic, trying to know each other, connect, knowing about the other NITAG and having that connection. Then the questions come very easily and there's a better understanding of this exchange.
Last question, and I will hand over to Vanessa and Joseline. Has the twinning supported research between the two countries, or was it mainly focusing on sharing experience?
So for our twinning, it is mostly about sharing experience. We didn't have like any research experience together.
However, I would just add, so this is the example of twinnings that are ongoing. But as you start the twinning program, you will have a first discussion touch point with your twinned, and this is where you will discuss what you would like to do within your twinning program. And if it is, if you would like to conduct a joint research, or if you want to focus only on one policy question like it was suggested in the question, this is up to you. It's really about what you need and what you would like to achieve through that program. So twinning allows this flexibility. So use it as you wish and as you and based on what you need for your NITAG. Angela, is this an old end or did you want to complement? You're on mute.
Yeah, thank you, Luis. No, it's a comment of the last issue that you talk about to make a specific considerations about, for example, HPV, or for us, for example, we have some couple of meetings with other NITAGs independently of the twinning because the RSV introduction in Latin America, and try to share our experience to introduction in Argentina. And it was very, very useful because we connect with the specific topics, specific situations, and are very rich to try to share our challenge, our difficulties, what it is very important to organize previously to the introduction, the different steps, So this type of connect to try to connect with other countries for specific points, specific situations, I think it will very useful as a second objective of the twinning program.
And probably for NITAGs that are starting or do not know necessarily how to start the process, having a common policy question or one policy question that the NITAGs is currently looking at is a good baseline to start. And then as you move forward, then you will start sharing your experiences and may realize that you can do other activities within that twinning. But it's a good, as you said, Angela, I think it's a good starting point.
And I think that is very important. That perhaps is our challenge for us, especially for Latin American countries, and of course for me, because of language, is to try to publish the decision-making process. It's very important to publish, because it's very important to share this experience to the globally. No, it's not easy, but it's very important to have this published, because it is a global experience that is very important, especially with the new introductions, of course. No?
Thank you. So with that, we've gone beyond time, but I think it was a useful discussion. So I really want to thank the presenters and the panel members for a fruitful discussion on twinning. It is new, so we are learning as we are doing. There will be a follow-up discussion at the GNN meeting, fingers crossed, in October. And I see in the chat one last comment, which I think is very timely. Beginning of July, the ADVAC, the Advanced Course for Vaccinology, is opening their call for application. So 1st of July, they open the call for application, and you have usually up until 15th of November to apply. I will put that information in my GNN monthly update. We really encourage NITAG members to apply to participate in this 2-week vaccinology course. It is in France. There are a few NITAG members that have already participated. It will really benefit you in your career, but also your level of understanding and of contribution to the NITAG. Therefore, we are keen to support your participation to ADVAC, either by writing a recommendation letter for you, and that can be done by the regional office or by myself. Please reach out and we can support, but do consider applying to the ADVAC course. The call for application starts early July. And with that, I thank you for participating, and I hope I will bring good news in the summer for the organization of the GNN meeting. Once I circulate the GNN meeting dates that they are confirmed, please make sure you're available to attend. Thank you so much.
Thank you. Bye-bye.
Bye.
Thank you. Bye-bye. Next.
Everyone.
Thank you, everyone. Bye.
Yeah.